We will undoubtedly see many travelers returning to the U.S. with Zika. There are about 40 million people who travel from the U.S. to Zika-affected areas each year. Many of those will come back with Zika. If it's like dengue and chikungunya in the past, we will see hundreds or thousands of travelers returning to the U.S. And unfortunately, some of those individuals will be pregnant women.
The hearing comes with some very bad news breaking as well. Brazil's Ministry of Health is confirming today 3 deaths related to Zika. And the last one happened in April. And the virus has now been linked to an eye abnormality that can cause blindness in babies born with that disease you keep hearing of, microcephaly. I want to get some of the straight answers on what these risks are with Dr. Sanjay Gupta, who joins me live. Sanjay, thank you so much. You know, up until now, I was prepared to ask you questions about the spread of Zika here in the United States, and I will get to that. But then this morning, the news of these 3 deaths in Brazil, and these were not babies. These were grown-ups. These were adults with Zika. Is this a new risk that we're just learning about, that it's now deadly?
No, I don't think so. I think, you know, what we've been hearing all along is the vast majority of people who get this infection are going to have little or no symptoms. And when I say vast majority, I mean 80% of people. There are some people who it's going to be riskier in. It could be people who have underlying illness. It could be people whose immune systems are suppressed. We don't know. There's one of the cases, one of the people down in Brazil is a 20-year-old woman who apparently had no other medical history, but it's also challenging sometimes to know, did she have Zika for sure? Was this another infectious disease? And it speaks to the capability of the testing right now, Ashley. It's not perfect testing by any means, so they don't always know for sure if in fact Zika is what led to her death.
Okay, Sanjay, there are now 20 United States, states within the U.S. that have reported the presence of Zika. And you just heard that testimony on Capitol Hill saying tens of thousands of people are going to and from infected areas all the time. We may not have mosquitoes because it's winter right now in a lot of the U.S., but that's going to change. And with 20 states affected right now, and almost certainly more states are going to be affected with those kinds of travels, how concerned should Americans be? And not just for pregnant women, for everybody.
Well, you know, as you might imagine, Ash, I've been thinking about this issue almost nonstop for a few weeks now. And, you know, Tom Frieden, the head of the CDC, says 40 million, I think, people go back and forth to these infected countries, areas that have Zika that is spreading. Here's what I would tell you is that I think we're going to see cases of Zika probably in every state in the country for that very reason. But those are people, most of them are people who are going to these countries where Zika is spreading and then bringing it back into their system, bringing it back in the United States. What the real question is, and what we're really going to be looking for, is it starting to spread now within the United States? Local transmission, local spread, you've heard those terms. Is it happening? That's the question. What we know is that other similar viruses that are spread the same way, like dengue fever, for example, has spread within the United States, but has typically been small spreads and confined to areas like South Florida and South Texas, areas that the climate is very similar to the countries where Zika is now spreading. So you're right, we do have some of these mosquitoes in the United States. We will probably see spread, but I think it's going to be limited, and that's just based on what we already know.